Getting through a pregnancy is already a huge deal, right? But when you're also managing diabetes, something as simple as a common cold can suddenly feel, well, really complicated. But hey, don't worry, we're going to cut through all that noise and give you a safe, super clear plan.
So let's picture it. You're pregnant, you're doing a great job keeping an eye on your blood sugar, and then, bam, you catch a cold. The first thing you're probably thinking is, okay, what on earth can I actually take that's safe for me and for the baby? It's a really common question and honestly a super important one.
And that's exactly what we're here for. To give you the answers, we are going to walk through a really clear, evidence-based game plan to help you feel better safely and effectively without messing up your blood sugar control.
First things first, let's talk about why a simple cold just isn't so simple when you're in this specific situation. It's kind of like a double challenge, and it definitely needs a little extra attention.
So what's actually going on in your body? Well, during pregnancy, your immune system is naturally a bit different, which can make you more likely to catch a bug. On top of that, all those pregnancy hormones can make a stuffy nose feel 10 times worse. But here's the absolute key for anyone managing diabetes. When you're sick, your body releases stress hormones to fight the infection. And guess what those hormones do? They can send your blood sugar soaring, making it way harder to control.
Okay, so knowing all that, how in the world do we pick a safe treatment? Well, think of it like this. We need to run every single option through a simple but totally non-negotiable checklist. Let's call them our 3 safety filters.
Anything you're thinking of taking has to pass these 3 tests. Number 1, and this is the big one, it has to be safe for your baby. No exceptions. Number 2, it needs to be glycemically neutral, which is just a fancy way of saying it won't spike your blood sugar. And third, it's got to be safe for your blood pressure, which we know is already something to watch carefully in a diabetic pregnancy.
Now, if you remember one thing, make it this. This is the golden rule. Stick to single-ingredient, alcohol-free, and sugar-free medicines. You want to avoid those all-in-one cold and flu formulas like the plague. Why? Because they're often packed with stuff you don't need and worse stuff you have to avoid, like hidden sugars or decongestants. The safest bet is always to treat one symptom at a time.
All right, before we even touch the medicine cabinet, the absolute best and safest place to start is with things that aren't medicine at all. This is your first line of defense, and these options are 100% safe.
Steam inhalation, just leaning over a bowl of hot water, is amazing for calming a cough. Warm saltwater gargles are a classic for a reason. They really do help with a sore throat. A little bit of honey and warm water can feel so soothing, just remember to use a small amount. And a simple saline nasal spray, it works wonders for that annoying post-nasal drip. The best part? They all work, and they have absolutely zero effect on your blood sugar.
Okay, but let's be real. Sometimes that's just not enough to make you feel human again. So let's build out our safe medication plan, taking it one symptom at a time.
So you've got that dry, irritating, hacking cough that just will not let you sleep? The ingredient you're looking for is dextromethorphan. It basically just sends a little message to the cough center in your brain telling it to, chill out for a bit. And here's why it's our top pick. There is a ton of research showing it's safe during pregnancy. And most importantly, it passes our safety filters. It doesn't mess with your blood sugar or your blood pressure. Just make sure, and this is key, that you're getting a product that only has dextromethorphan in it, not a combo formula.
Now, what about the total opposite problem? That wet, heavy, chesty cough where you feel all congested. For that, you want something called an expectorant. And the safe choice here is guaifenesin. Its job isn't to stop the cough, but actually to make it more productive by thinning out all that gunk so you can clear it.
So a quick note on this one. Guaifenesin is considered safe in the 2nd and 3rd trimesters, but you'll want to talk to your doctor before using it in the 1st. It passes our glucose and blood pressure tests, no problem. But, and this is crucial, it only works if you drink a ton of water with it. Seriously, without lots of hydration, it just can't do its job.
What if your main complaints are sneezing, a runny nose, or that tickly cough from post-nasal drip? Well, then you're looking for an antihistamine. Your safe bets are things like chlorpheniramine, diphenhydramine, which you probably know as Benadryl, and loratadine.
These guys have been around forever and have really solid safety records for pregnancy. They won't affect your blood sugar or blood pressure. And you've got options. If you need to function during the day, a non-drowsy one like loratadine is perfect. If that cough is keeping you up at night, one of the more sedating ones might actually help you get some sleep.
Okay, I need you to listen very carefully to this next one. When it comes to fever and body aches during pregnancy, there is only one recommended over-the-counter option. That is paracetamol, which you might also know as acetaminophen.
period. And this is so important. Getting a fever down isn't just about feeling more comfortable. The fever itself, that higher body temperature, can actually make your blood sugar spike. So by bringing that fever down safely with paracetamol, you're also actively helping to keep your blood glucose in check. Now, for what is maybe the most important part of this whole chat. We've talked a lot about what you can do. Now we need to be crystal clear about what you absolutely cannot do. So please pay very close attention here. I'm just going to let that sink in for a second. This isn't a suggestion, this is a critical safety warning. The drugs we're about to talk about fail our 3-filter test, and they pose a real risk.
First, you have to avoid oral decongestants. The ingredients to watch out for are pseudoephedrine and phenylephrine. They're in almost every cold and sinus product. Why? They can raise both your blood pressure and your blood sugar. Second, you must avoid NSAIDs, like ibuprofen. They can cause some really serious complications in pregnancy, especially later on. For pain and fever, you stick only to paracetamol.
I know, that was a ton of information. So let's pull it all together into one simple, easy-to-remember action plan.
Think of this as your cheat sheet. Let's run through it. Do start with things like steam and gargles. Do use single-ingredient medicines to target your symptoms. Do treat any fever with paracetamol. And do check your blood sugar a little more often while you're sick. Now for the don'ts. Absolutely don't use those all-in-one formulas. And definitely don't use decongestants or NSAIDs.
Look, the whole point of this isn't so you can self-diagnose. It's so you feel empowered. This knowledge is a tool you can use to have a really confident, informed conversation with your doctor or your pharmacist. Together, you can create the perfect, safest plan for you and your baby.